I'm Victoria Foisey. I'm the Managing Director for InMode UK and Ireland.
I'm Salvatore Pagano, Italian plastic surgeon, international KOL from InMode.
I'm Dr. George Christopoulos. I'm a plastic surgeon based in London. I'm the lead KOL for InMode for UK, and I'm assistant professor of aesthetic medicine.
Salvatore, how long have you been working with InMode for?
It's 12 years that I'm in InMode family, and I'm very pleased because I'm Italian, and I strongly believe in the concept of familia. And it's true that InMode it's my family in sense that we work hard and we try to do our best, and we bring to our patient best technologies and the best advances. So that's why I feel very comfortable to work with InMode.
That's great. George, how long have you been working with InMode for?
I've been using the InMode technology for many years anyway, because they've been in the market for a long time, and they were always one of the best choices that you can have during your surgeries or before and after the surgeries. But I've been close to InMode family for the last couple of years, and I'm the main KOL for UK the last year. So I have been engaged with the latest development of InMode, and especially the Ignite platform over the last few months, and that has been already a journey that has been fascinating, even though that is short period, over for 6 months already that I've been using the Ignite, but it has been fascinating, and I'm looking forward for what is coming in the future.
I feel very lucky and grateful to have such amazing resources as KOLs to use. InMode is the #1 energy-based device company in the world, so feeling very proud of that, and we put more money into R&D than any other company globally, which is fantastic. Obviously, a lot of our R&D that has been launched this year was around the IgniteRF. Can you tell us a little bit about it, Salvatore? What is the IgniteRF? What does it do?
Yes, it's more than 12 years that I'm with InMode, and I was first one in Europe, together with another Italian surgeons, and I have the same feeling with Ignite as when we introduced BodyTite 12 years ago. So it's a game changer, because now we have perfectionated something that we know that already was working, and nowadays we are much more precise, and we control the power of heating exactly where we want. So that is Ignite. It's all in one. We have all the system, all the technologies. We have the turbo cannulas, we have the quantum cannulas, we have the new Morpheus. So nowadays we are able to exactly target our treatment and personalize to any treatment. So that's why I'm totally sure, and I feel excited like many years ago, that Ignite will be the new game changer.
For sure. I think, we had the same kind of hype around Morpheus 8, and now today, every 8 seconds around the world, Morpheus 8 is performed. But it is predicted that in about 4 or 5 years' time that we're going to be doing more quantum treatments than Morpheus 8. Do you think that's realistic?
Exactly. Morpheus is a brand. Everybody knows it, and Morpheus is the new Botox. So patient call the clinic and ask for Morpheus. They don't ask for fractional radiofrequency treatment. Some patients even don't know what is Morpheus, but they know that it works, and they know that they want it. So that will be the same with Ignite. So they will ask for that treatment, because that treatment is a compound, summarize the result and the effectiveness of it. So that will be the prediction, and we are expectant and want to see it as soon as possible, because all of us that already tried the platform nowadays just use only this platform. So that will be will be the real new game changer.
For sure. I think it will change the landscape of face and body contouring forever. George, you were the first doctor in the UK to have the Ignite platform and work with the quantum technology. Tell us a little bit about quantum.
Yes, I was very lucky to to have the device early during the last summer, and I was the first clinician, the first plastic surgeon who used it. So because we have, me and Salvatore and most of the members of InMode faculty have the background of plastic surgery, we can expand the utility and the versatility of those platforms, the new platforms of InMode, to different directions. So we can stretch it from the minimum invasive approach, where we can use it in a way that the patient has low downtime and no surgical setup, up to the other end, to use it in the very high-end, complex operations that we want to do, a refinement that only the energy technology that is as precise as the new InMode Ignite can give us. So I was able to explore and experiment in all those directions, but in a way that the safety net that the InMode technology can allow me to do so. Yeah. So I think it's difficult. It's even more challenging for InMode nowadays, that is already in the really high level, and we have the InMode devices in a lot of clinics worldwide to do the next step. But with the Ignite, and especially with Quantum, I think InMode has done it one more. And having the technology that allows us to use the bipolar radiofrequency system, because this is what Quantum is, a bipolar radiofrequency system that it can be placed exactly in the depth that you want, it is a game changer. So we're talking about a deep Morpheus here. We're talking about a device that it can be effective, versatile, and safe in the same way. So that gives us enormous potentials, and I think all plastic surgeons should get engaged with InMode technology, and especially with Ignite, but also all other non-surgical clinicians that they want to have a really powerful and safe tool in their practice should engage with Ignite and new Optimus device and all the technologies that only research can lead to those developments, and the research that gives us all the tools that we are able afterwards to implement in our daily practice and give the best results for our patients.
Brilliant. Salvatore, tell me a little bit about the patients that come in to see you. I know you do a lot of BodyTite. Is the BodyTite Turbo sort of changed within your clinic? Is that accelerating your results?
Basically, my patient trusted me. Mm-hmm. So as I was pioneer in technologies, most of my patients tell me, "Doctor, I trust in you, give me and do me what you think this is best option." And that's what I do. I investigate in the market since many years ago, almost 15 years ago. And I'm in constant challenge to see what is the best for my patient. Mm-hmm. So that's why I started with BodyTite, then Morpheus, FaceTite, and nowadays Ignite is the plus. Because as George was saying, Quantum is the plus that we want to complete our portfolio. And it's developed by Alfredo Hoyos. Alfredo Hoyos, for those who knows, is the father of high-def liposuction from Colombia. And you know, in Latin America, all of patients get operated. So what he bring to InMode company is this kind of cannula that allow to be very versatile, very precise. When you are inside with that cannula, you feel it, because you heard the pop of the tissue that is going to retract. You feel that is the fat that is melted. And it's very, very exciting to have it when you try the first time. Yesterday, I had a training with the doctors of BodyTite, and they tried the Quantum cannula, and they ordered the Ignite.
Straight
so Exactly. So this is what I try to offer my patient. Best option, and knowing from the science which are the technologies and what works, plus we selected and offer the best option for our patient.
Fantastic. So what do you think are going to be the trends in our industry for 2025? What are patients going to come in and ask you for?
You know, the trend is clearly through minimum invasive treatment. So our patient want fast recovery time, want nice result, stable result, no scar, no general anesthesia. They want to do the surgical look. So we are moving to natural, to harmony, to regenerative, and no fake, no artificial, no heterologous product, no external product, but is regenerative medicine. So this is the trend, and that's why with Ignite and with Optimas and with Morpheus, we have a chance to stimulate the tissue. So we stimulate the tissue and we wait for the answer.
Yeah.
And depending on the target, depending on the tissue that we are going to stimulate, we will expect an answer. That could be the fat removal, fat emulsification, that could be the tightening, that could be cellulite treatment, that could be acne, that could be hyperhidrosis. So we have the answer for any different indication. So trend is regenerative, minimal invasive, local, and long-lasting result.
Brilliant. George, do you agree? Is that what you're going to see in the UK?
Yes, I think it's global phenomenon, this one. I think the trend over the last few decades, actually, it is for people to seek less interventional treatments, so minimally invasive for the face, for the body. But then the challenge is that they need to manage their expectations, but they expect to see some results. You cannot offer an alternative to surgery to the patients just for the sake of avoiding the scars. They need to see some results. And the best choice that is available as an alternative to surgery is to use the technology. And which technology? The technology that it can safely deliver those results. And the new Ignite platform, it can definitely get you there. So the trend, the global trend, is to go to at least as a first approach, to search for something less interventional and avoid the scarring. And in some of the cases, this is exactly what the patient needs. Not all of the patients are good candidates for a surgery. They can have procedures which can give them what they want according to the indications that us alpinicians are able to identify. They give them the best results customized according to their needs. And this is the trend that only can be achievable if you have the right tools. Yes. And Ignite can give you the right tools to do so.
As plastic surgeons, what are the most popular procedures in your clinic, whether it be InMode or not? What do you do the most of on a day-to-day basis? Or does it completely vary?
Nowadays, body contouring, it's one of the most demanded procedures. Of course, breast augmentation, breast elevation, but a lot of lipo contouring, abdominal contouring, and everything referred about the abdomen. But it's true that even nowadays, patients asking for outpatient procedures that does not need too much recovery time. And even with Quantum, we have nowadays a chance to do treatment without aspiration. So it will be interesting for the patient, and it will be interesting also for the doctor that are not used to give a real opportunity to treat efficaciously this kind of this area. The most important things, and I'm totally agree with George, is the right indication. So we are doctors, we have to select the right treatment, we have to tell the truth to the patient, and the patient have to understand if that treatment works and is suitable for him or not, and to choose the right operator, because all this system need a learning curve, need to know how to use. It's like I always say, I'm Italian, it's like to drive a Ferrari. you can enjoy the ride and you can drive fast, but you have to know how to drive. So that's the same concept. So these are very strong and powerful machines and need to be treated and used by qualified doctors that have been trained with the international KOL like me and George. And once you have and control the system, you can give the best option for your patient.
Mm-hmm. George, what about you in your practice? What's the most popular treatments, procedures that you're doing?
A lot of different procedures. So in my practice, the philosophy that we have in my clinic is to offer to the patients the whole spectrum of treatment options. So this is, I believe that is a key element of good medical practice. So we need to tell the patients what are the possible treatment plans that we can follow. So that one can vary from completely minimally invasive, like injectable regenerative treatments. It can go up to the most complex surgical procedures if we have the right indication, but there is a huge gap between those two ends. There is, and this gap is filled with energy-based devices, and the energy-based devices that are based in radio frequency are more versatile, and especially the most efficient ones are the ones from InMode. So I talk to the patients, to my patients, after I'm doing a really thorough evaluation. I talk to them about all different treatment options. So most of the patients like to have, especially for the face, which they're a little bit scared of having like big scars, that they have some degree of unpredictability of how they're going to develop. They want for the face, and especially for the jawline, to have something that it can give them significant results without the downtime and without the scarring. And one of the most popular treatments in my practice is the lower face definition and the neck definition, and having tools like Morpheus 8 and like FaceTite and like InMode and like the new Quantum can give you the best option that you have to offer to the patient the best jawline definition.
It's that big trend at the moment, isn't it? Everybody wants the V-shaped face.
It has always been a big trend, but we didn't have the right tools to give to the patients the best results. Now, with all the developments that InMode is bringing to the market, we're able to offer to the patients the optimum of those results. And then going down to body areas where either we perform in our clinic a lot of surgical operations, then now the patients can look for the extra thing. So they look, okay, I will have better contour, better shape, but I want a little bit more definition there. Can you help me to have a better defining of our muscles? Can you do that? And what about the skin? It will be placed in the new position. However, it looks like it is thinner. It looks like it is not so elastic. So can you do something about that? And having the right tools can give you that extra bit that you cannot achieve with your forceps and your scalpel. You need some extra tools that they can give you that edging, that skin improvement on the skin quality. And using the technology from InMode can definitely give you that.
Nowadays, with the socials, everybody is interested in his face, in his profile. There is a lot of selfie with different angles. So we have noticed in our practice, they ask and they say, look, doctor, I want to improve my chin projection. I want to improve my mandibular line. I want to remove my submental area. And till now, the only option were fillers. Injecting fillers, and add volume. And the concept is that instead of adding volume and external volume, with this system, with Morpheus, with FaceTite, we are able to tighten, to lift. And we lift without the scar, so that is the ideal point. We in a local anesthesia, 30 minutes, we are able to remove all the submental area and to have an effect very, very similar to a facelift, and without the scar and without the recovery time. And it's almost immediate result. So after the procedures, the patient see it, and they are very, very happy with the result and excited with it. So that is a game changer.
Yeah.
Because instead of adding, instead of unnatural or
Overfilling,
fake, is
yeah.
stimulating and tightening the tissue and melting the fat in order to have a lighter and more harmonious face and profile.
Yeah, for sure. 65% fillers are down in London this year compared to last year, which is massive. And it's because of this rise in energy-based devices and the type of treatments and outcomes that we're able to get from our treatments.
Some of the fillers, some of the injectables or other energy devices have been overused, have been used without the right indications. So people are able now, we're living in an era where we have the social media and everything is exposed there. So people are able to see all the potentials, but also is able to see the exaggerations, to see the results that they are not so appealing. So when you can offer to the patient something that is completely natural, something that respects your own tissues, and give you results that suits your face or your body, then the patients will seek for it, and they will search for it, and they will come for it. So that's why InMode technology has been popular all those years. So people are looking for the results that they are natural and they are long-lasting, and InMode platforms can definitely deliver that.
Brilliant. Salvatore, what do you love most about InMode?
What I like most about InMode, I like the concept of group and integration. So there is not the boss and the doctors. Everything is meted. A good idea, independently from they come, are welcome, and everybody give his support. I'm a senior, there are young QOL, and even doctors, not doctors, everybody make his own part in order to grow, because the concept is to have the best technology and the best tool in the market. So that's what I love, and I love the friendship. So I repeat, because I'm Italian, and I like the concept of the familia, so the circle. And in InMode, everybody that is a good person, good professional, and with good idea is inside.
Yeah, we love that too, for sure. George, what do you love most about InMode?
What I love most, I think the element that I love most is the InMode philosophy that is always looking forward, and that is the way that we progress. So in order to be ready for the future, you need to create it. So InMode is not settling. So investing in research and then trying to produce even better technology, even better tools to give to the surgeons, to give to the clinician, to give to the patients. So this is what I love. We didn't have quantum technology 1 year ago, but it was under preparation. We didn't have all those advancements in Morpheus 8, on FaceTite, on BodyTite, but it's always something new. And you have always the feeling that there is a team, the whole team, that is looking into the future. And this is the best thing that I like with InMode.
Brilliant.
And I would like to point also on the top that...
I would like to change the thing that I said.
No. Just to say that...
To emphasize.
To emphasize
Say
on the
it.
top
Come on.
every single penny is inverted in Hermes D. So this is the philosophy of the great Moshe. And that's the reason why it has the biggest and the strongest RD in the market in energy device. And that's the reason why they develop any kind of system and technology, improve any kind of system technology that works. Because this is the philosophy. And every time Moshe asks me, okay, something new in the market, something that we should have in our portfolio, and this attitude is a contagious attitude, because you are always thinking on what I can do best. In improving.
Yeah.
This is a Japanese concept, this kazei, that is always improve what you are doing, trying to do it better.
Can you tell me about one of your best patient success stories that you've got?
Somebody that I remember, because it's quite close, is a patient that had a facelift. She was mid-age, she was 52, quite beautiful and young patient, and she was very upset about the result because she has a redundant skin in the submental area with a bulging area, especially in a dynamic movement, and of course she didn't want to redo the surgery, and she was totally scared about surgical look and about anesthesia. So I tried to fix her with a combination of BodyTite and Morpheus, and I was able to success, and she's very happy with the result because the skin retract even in these secondary cases that are very challenging cases because there is fibrosis, there are scars, and we don't know how the tissue will behave. So even in those cases, we can use the technology in order to fix a problem and result. So I was very happy about it, and I show this case also in my congresses and presentation because it's a way to show the doctor, especially the surgeons, that we are surgeons and we like the surgery and we like the scar. But we have to listen our patient because most of cases, if you listen the patient, you find the right solution for him with a useful tool.
Good stuff. George, give me an example of a patient success story.
I had one patient who had liposuction in the past in an uncontrolled way, so there were a lot of irregularities on the abdomen with some residual fat pockets, with some adhesions that the patient was waiting to have a bikini ready body, and ended up with a complete lack of confidence of taking her clothes. We performed there a really targeted approach, and I've done some precise liposuction wherever is needed, but I used the Ignite technology in order to equalize everything and give the right definition exactly where it was needed. So we can use like tools like the new Quantum that gives you the possibility to go with energy exactly where you want and break the adhesions that they have been accumulated from the previous surgery, and go afterwards with the Morpheus 8, and this is what we did, to go afterwards from outside and help the skin to retract in a natural and efficient way in the new position. And then she was extremely happy, and she was sending me pictures for her vacations and with enjoying her new body. And this is what you want to get from feedback from your patients.
Amazing.